Doctors, what is your most surprising, I can't believe I need to have this conversation with an adult story? Paramedic here, was driving with my partner and patient in the back. Patient was fine. Patient's skeezy boyfriend was riding in the front with me and apparently saw a golden opportunity to ask a question that had obviously been on his mind for some time. Him. So when cats and dogs eat grass, that means they have cancer, right? Me. No, it does not. Made for an awkwardly silent ride the rest of the way. Ha ha ha, what the F? And really, why did he even assume a paramedic would know whether or not animals have cancer? Well, it looks like she's about 30 days pregnant. Congrats. How can she be pregnant? She's only around her brother. Well, actually, they don't follow the same moral code as you or I. Veterinarian. My fragile sanity wishes you had started with veterinarian. LOL. Not a doctor yet, but an ER tech for about 2 years. Mom comes in with her baby plus 2 more older kids, complains that the baby hasn't pooped in a while and won't stop crying. As I'm settling them in with one of the nurses, the baby is bawling, like opera singer lungs bawling. Suddenly, Mom whips out a plastic shopping bag and sticks an end in the kid's mouth, says, "This is the only way she stops crying." Nurse and I share a look and immediately order an emergency x-ray on the kid's stomach. Turns out she'd ingested a good amount of these bags and it was blocking up in her stomach. Big deal, potentially life-threatening. When we confront the mom about her baby feeding habits, her only words of defense are, "Well, I checked all over the bag and I couldn't find anything that said non-edible." Too long didn't read, Mom had been letting her baby teethe on plastic bags because she didn't know they weren't edible. God, hope this mother lost custody of her children. I don't know if I would go quite that far, but holy crap, that is just, how do you not know that? I don't even know what to do with a person like that. That the 30-plus cups of coffee he was drinking every day could possibly be the cause of his chief complaints of anxiety and insomnia. He said he was not willing to give this up or try decaf. 30-plus, man, I'm such an amateur. Your heart thanks you for your amateur ways. While in dental school, my friend pulled out several bombed-out, technical term, teeth on an adult male. After the procedure was finished and post-op instructions were given, the man asked, "So when should I expect my new teeth to grow in?" He was serious. My significant other is a med student. He helped to diagnose a 40-year-old woman who finally sought out a doctor after having open, festering wounds on her entire torso for over a year. The open wounds only appeared after more than a year of painful visible lumps on her breast. She had never sought treatment prior to this. Significant other had to inform her that her entire body was riddled with cancer, that there was no treatment to help her, and that she would be dead very soon. Her sister, who was there the entire time, began loudly proclaiming what a shame it was that nothing could ever have been done, and that hopefully someday we would be able to detect cancer sooner. Significant other watched the doctor explain that pretty much any other woman in the country would have gotten effective treatment at the first sign of the lumps. This was during Breast Cancer Awareness Month. The sad part is, part of this might be that the woman couldn't afford to go see the doctor. I mean, if you have lumps, don't chance it. Go in. Money can be figured out later, hopefully. I saw a patient who was concerned because she was still lactating despite the fact that she stopped breastfeeding her twins 2 years ago. She said, "Sometimes I wake up in the middle of the night and find my husband sucking on the breasts. He says he's trying to drain the milk for me." I had to explain to her that breastfeeding her husband will lead to continued lactation. What? That's so creepy. Don't worry, dear. I'm helping you. As a veterinarian, I had a 10-minute conversation with an owner explaining which side was the dog's left side. I worked at a vet clinic when I was in high school. One day a vet came out of an exam room and asked me how to tell whether a puppy was a girl or a boy. Thinking it was a joke or a trick question, I said, "You flip him over and look, right?" The vet sighed and walked away. Apparently, this client who fancied herself a breeder, multiple litters at this point, expensive breed, had asked dead seriously how you tell if a puppy is a boy or a girl. I had to explain to a client that just because his puppy had nipples did not mean it was a girl. Medical assistant to a cataract surgeon here. If you effing sleep in your contact lenses long enough, they will fuse to your eyes and you will need surgery to have them removed. Yes, you can go blind from this. For the love of God, don't sleep in your contact lenses. Got placed doing a rotation in the orthopedic floor of a big hospital in a rural area of Southern California. I was doing my rounds and saw a patient out of bed and walking around the floor following a knee replacement. She had a cane in her hand that she was carrying like a soldier would carry a rifle. I asked what she was doing and what she thought the cane was for. She replied she thought the cane was for pushing people out of her way since she's now handicapped, and it wasn't to help her walk on her post-op knee. This is the first response that genuinely made me laugh out loud. I can just imagine some cranky old woman swatting people out of her way. I have a cranky old woman story for you. My mom worked at a nursing home as a cook. They ended up having to take away the electric wheelchair of a resident that was 107 because she kept running people over when they made her mad. She was my mom's favorite resident. What a coincidence, because she's now my favorite resident too. Get him good, Granny. Talking to the children/POAs of nursing home residents about vaccines. Most will just sign the flu shot form. Some believe it will give their 90-something grandpappy autism. Pharmacist, but comment still relates. Had a lady call in complaining that their husband's Viagra wasn't working. I then went on to explain to the patient's wife that in order for the medication to work, the patient needed some sort of stimulation. The lady just screamed aloud, "Me?" and then hung up the phone. Still my favorite Viagra story. Client brings in her dog for a tick she tried to burn off. Looking, I see it's a nipple and tell her this. She says, "But he's a boy, how can he have nipples?" I say, "Ma'am, your husband has nipples." Blank stare, then light bulb moment for her. My friend is a student doctor and is on placement at a small town doctor's office. She had a 70-ish-year-old woman come in with complaints of a small but painless growth that was visible at the back of her throat. Turns out it took her 70 years to notice her uvula. That must be the uvula. Oh, so it's a girl house. Was so not a film for kids when you look at the whole movie and its contents. There were intimate and drug references. It was pretty scary for a kids movie, and I just felt a more teenage vibe watching it. Not a doctor, but I regularly have people come in for eye examinations because when I take my glasses off, things are blurry. Often these aren't passing comments during the exam, but the main reason for their visit to the clinic. During residency in an urban Northeast USA city, I was in clinic. A very pleasant 50s-something lady came in for a physical. Everything was going fine when she casually asks if there are any new vaccines out. She was up to date with everything, so I asked if she had any specific concerns. She was casually asking to see if she could vaccinate her gay adult son against homosexuality. Very nice. Always had a smile on her face, even when I broke the bad news to her. I'm going to recommend 50 cc's of your son not coming home for the holidays. It won't reverse your son's gayness, but it will alleviate him of its most unpleasant side effect. Patient comes to ER, 19-year-old male. I'm getting his history. Why are you here today? Every morning when I wake up, my stomach hurts. How long has it been hurting? All my life. Well, what is different today that's made you come here? My girlfriend doesn't think that it's normal. More questions, exam by ER physician, lab tests. The abdominal pain always goes away after he eats. Always. He wakes up hungry. He thinks it is pain. Not a doctor, but I'm a former Special Forces medic, and I treated indigenous populations in Iraq, Afghanistan, and several other Middle Eastern countries. Some of the patients and their families asked incredible things of me, such as putting brains back inside after an explosion took half the head off. But I have never been as incredulous as when I had to explain wrong hole to a very old tribal elder who was wondering why he couldn't father any children. Please like and subscribe if you've made it this far. I hope you'll enjoy the rest of the video and have a wonderful day. My mom tells it so much better, but here's a try. My mom was the head nurse at a clinic here in Houston in the 80s. She worked for an old World War II doctor that had gone into private practice, old school GP, when he returned back to the States. Well, one afternoon they told me she had a patient come in that was running a high fever and was complaining of pain in her pelvic area. Mom also tells me that there was a stench coming from the woman's lap that could only be described as enough to gag a maggot off a meat wagon. She begins to interview the patient, who told her that her and her boyfriend had been intimately active and that she had been in pain since. She thought that the woman may have contracted an STD and asked her to undress and wait for the doctor to examine her. The doctor arrives and closes the door, only to reopen it a few seconds later, mentioning about the need for fresh air. The doctor notices that there was a vaginal discharge, began to question the patient about her intimate life. Was it protected, non-protected, etc.? According to my mom, the patient told her, "No, doc, we always use a rubber." The doctor looked down, then noticed that there was a small rubber band extending from the woman's vagina. The doctor reached in with his gloved hand and pulled it out. What came next can only be described as a magician pulling the magic cloth out of someone's mouth. One rubber band after another came out over the course of the next 10 minutes. Finally, once they were all removed, the doctor had the talk with the woman about intercourse education and that rubber bands were not a successful contraceptive and not what they meant by wearing a rubber, and then wrote her a prescription for ABX. That's disgusting as hell, but I wanted to comment mostly because you used the phrase, "gag a maggot off a meat wagon," which I've never heard anyone but my dad say. Funny to see it in the wild. To be 100% serious, this is why proper intercourse education is so critically important. This is one of those things where I desperately don't want to believe it's true, but we all know it is. It is definitely true and almost certainly not the only case of this happening. I'm sad now. Not a doctor, dental hygienist. Had to explain that brushing your teeth with Comet, the cleaner, was not a good way to clean your teeth to a 40-year-old woman. Also had to tell the woman that painting her teeth with white fingernail polish was a bad idea. A 30-year-old grown man asked me if the hot spells he was experiencing at night meant he was going through menopause. Well, it's not called womanopause. I had to explain to a grown man I still work with that tampons don't break down in a woman's urine after they were finished using them. He's been married 12 years. It was not his best day. My mother helps the Amish get dental care. One Amish woman complained that she needed new dentures. When asked why she thought so, she replied, "Well, I've lost weight, and you know that when you lose weight, you lose it in your gums first." Doctors and dentists, if you're looking for a community to serve, the Amish can truly use your help. I could write a book about the things I've seen. We're waiting on that book of yours. That's actually not as ridiculous as it sounds. Many elderly people deal with weight loss due to a number of reasons. As a result, they tend to lose muscle mass in their mouth/jaw, and it often leads to dentures not fitting properly. Dentures tend to be very expensive and are usually not covered under insurance after receiving your first set. This can lead to further exacerbation of issues relating to eating and further weight loss. Kind of sad. I was a newly minted graduate with fresh and optimistic views on my life as a doctor. Second week in came this old lady and her very dysfunctional family. They would argue and complain about everything, from the food, the nurses they didn't like, and every single medical decision we made. She was very, very sick, so her management was just as complicated. She had several children and they all didn't like one another and would not talk to one another. Each time we would have to explain a long update to every single one of them because they are entitled to hear it from a doctor. One of these stories being sitting down and explaining why you don't give Gatorade as an IV drip. They did not understand why we were giving salt water to her. Conversation with her son. Look, she likes Gatorade. She is drinking it, so why can't you give it to her through her drip? We explain why. Son frowns. But it's isotonic. We explain again. We explain again. Salt water just seems to be too cheap. Can't you give her something else closer to Gatorade that has electrolytes? Continues for 2 hours. Wash and repeat every day during her admission. Afterwards, I told my fiance. He opened up a scene from Idiocracy on YouTube, and I just sat there with my mouth open for a while. Yeah, come on, Doc. Brondo's got what sick moms crave. It's got electrolytes. While on dermatological rotation, a Middle Eastern patient saw me with what she described as some funny itching growth in her butt crack. Some quick investigation revealed it to be a severe case of genital warts. I explained the diagnosis and that it was an STD until she shockingly assured that she was still a virgin. Now, virginity is a big issue for young Muslim women, or perhaps their families even more, but apparently that doesn't cover anal intercourse, and therefore no birth control in the form of, say, condoms was needed. Edit. I thought I'd share another story, but this time with a colleague being the one acting stupidly. This was when I finally made it to neuroradiology, and in comes this mother whose maybe 3-4 months old son we would scan today because he had epileptic seizures after his birth. Apparently, the pediatricians didn't tell her about the fits nor the severe neurological birth defects they knew about for weeks, so I had to explain to her that her child had mental disabilities. That was probably the first time I flipped out on a colleague I didn't even know over the telephone, and in the heat of the moment, wanted to find this idiot and spit in his face. He was totally oblivious to how he effed up, saying there was a language barrier while this hospital employs a whole department of translators just for such cases. Please leave your story in the comments. I would love to make a video on them in the future. Also, don't forget to like and subscribe.